Taoiseach, there are many issues that could be taken up today, the National Maternity Hospital, the redress for mother and baby homes, but I want to raise an issue of the inability to recruit and retain staff across the public health service that we're now reaching a crisis point. And this is particularly the case in the crucial area of home care services. Despite the increased allocation of hours by the government, people dependent on the service are actually receiving cuts in their hours due to staff shortages. I want to give an example of Kevin, who suffers from MS. Kevin needs help getting out of the bed, getting into the bed and feeding himself. He did have a carer visits of 4 times a day, and just over a week ago he was given 2 days' notice that he'd have no more visits due to lack of staff. In his own words, he felt he was being left to die. The situation has changed after he went public and those hours were reinstated. That is an extreme example of what people are facing, but many people dependent on these hours are losing those hours due to staff shortages. When you look at the pay and conditions for home care workers employed by agencies funded by the HSE, it's very easy to see why people are leaving or not taking up jobs. The norm for agency staff is a minimum wage of €10 an hour, 0 hours, no sick pay, no pension, and constant stress of getting from one client to the next. They have to provide their own transport and don't have any allowance for doing so. If you take an example of a carer in Dublin, they might have 2 to 3 clients in an hour. If they use their own car, the problem of traffic and parking fees, many actually use buses. The reality of their travel costs is that they actually earn below the minimum wage. In rural areas, they are being forced to speed, taking risks on country lanes, and the HSE pays these agencies €30 per hour per client. If a carer does 2 to 3 clients in that hour, that's €60 to €90 for the agency and €10 for the actual carer. Why does the HSE not directly employ these workers? They used to until the decision to privatise the services nearly. Directly employ these workers on a decent wage with a travel allowance, sick pay, pensions, etc. These workers provide a crucial health service for which they need certain qualifications. They are not just being overlooked, they're being undervalued. They are being abused, treated like dirt, and certainly not treated like the heroes they should be treated as. They were the ones on the front line, going door to door, client to client, and lost money during the height of the pandemic because families were afraid that they could bring the infection into their homes.
Thank you, Deputy Collins. Taoiseach.
Yeah, first of all, I think there's been a dramatic expansion of resources for home care hours. I think you'd have to acknowledge that. There was 5 million hours last year in respect of it. Sorry? Well, it had a huge impact last year in terms of reducing the number of people waiting for home care packages. It had a very significant impact. And there is a critical skills and eligible occupations review of people, of sectors of the economy that we need to liberalise in terms of work permits and getting so on. They have not recommended so far the removal of the occupation of care worker home carers from the ineligible occupations list, because I think the issue is that we do have to work with those who are providing these services in terms of the conditions and to improve them. But the big concern at the moment, the Minister responsible, to be fair, secured additional resources in last year's budget and in this year's budget. The issue is securing enough people to work in the service itself. And Minister Butler is working now in terms of engaging with the stakeholders involved, all sides. We're looking at the workforce challenges in terms of home support and in terms of nursing homes. But it's a critical issue for those who need the care. It's also a critical issue for our hospitals in terms of alleviation of pressure on our hospitals and flow through the hospitals, which, because of the additional hours last year, the flow through the hospitals last November and December was very efficient and very effective, and had a clear impact. So the issue is a skills shortage issue or a numbers issue, and I think part of what you're saying, I'm not disagreeing, we do have to look at terms and conditions in respect of home care workers, and that's something that the Minister is working with a workforce advisor group to engage and to deal with those challenges and to improve upon them, because across the board in terms of caring, it's an area that does need to be improved and enhanced upon.
Taoiseach, the fact of the matter is that over the last period of time, workers from the private home care sector are going into the HSE because the jobs are better, they're better paid, they're respected more, and they get their pension and sick pay, etc. And also people are not taking up the jobs because of the conditions. It's a fundamental issue facing our healthcare service right across the board. Last night we discussed the Sinn Féin bill on ambulance services, where we're seeing that the annual spend in private ambulance services had risen from 2.1 million in 2011 to 10.1 million in 2019. Now, how much are these private companies getting from the state to pay to serve people, clients and people that need the support in their homes? They are getting €30 an hour. The General Secretary in the Department of Health was offered a salary of 400,000 a year. That works at around €200 an hour, and it wasn't implemented. But I presume the head of the HSE is on something similar. And what a contrast that is with the pay of an agency worker on a minimum wage, doing the work they're doing, having to travel the way they have to travel, paying for parking, paying for petrol, paying for bus fare. Will you now, Taoiseach, move to directly employ these people in the HSE?
Thank you, Deputy Collins. Taoiseach, to conclude.
Well, first of all, I think the 75% of those working in the home care support sector are working part-time. And as I said last year, the Minister secured additional funding of 150 million for home support, and the HSE National Service Plan sets a target to provide 24 million hours of home support, and that's right throughout 2022. At the end of September, some 15 million home support hours had been provided to over 53,000 people. So there's an enormous programme there that's been resourced by government through the HSE and has grown very significantly beyond previous years. But that in its own turn has created pressures then in terms of availability of people to actually do the home supports. And for the moment, in terms of employment permits and so on, the home care doesn't satisfy the conditions, and the groups who are reviewing this believe we should first of all look at terms and conditions as they apply to home care workers here first, and that's what we're doing, to see can we improve those terms and conditions to improve recruitment here domestically.
Thank you.